Fistulas are one of the most debilitating conditions. A fistula is a small tunnel that develops near the anal canal. It usually starts as an infected oil gland in the anal canal. What happens is that little tiny gland in the anal canal gets infected. As it gets infected, it starts to expand and eventually ruptures out near the anal skin. Once that gland ruptures, a tunnel between the inside and the outside is what we call a fistula. This can be incredibly troublesome in that patients have discharge, pain, persistent infections, and hence they need surgical treatment. A patient may present with a fever, temperature, perianal pain, or when the fistula eventually ruptures. If a patient is diagnosed with a fistula, there are multiple different treatments, and those treatments depend on exactly where the fistula is. With fistula surgery, our whole goal is to deal with the fistula while also protecting the sphincter muscles which control continence. With fistula surgery, sometimes patients need multiple staged surgeries. In the first instance, our goal is to prevent any infection. Then afterwards, we'll either use things like an advancement flap, which tries to flap and seal up the fistula or seal up the tunnel. Sometimes we use a collagen plug, which fills up the tunnel, but there are multiple different procedures which we'll go through during your consultation.